Good afternoon. It is July 10th, 2009. We are in New York City in Manhattan, high atop the Metropolitan Hotel. And I'm very pleased today to be able to speak with Monsieur Jean-Pierre Barral. Monsieur Barral is a 1974 graduate of the what became the European School of Osteopathy in Maidstone, England. Additionally, Monsieur Barral taught for more than 10 years at the Faculty of Medicine in Paris, teaching osteopathy to our MD counterparts, and has a very interesting history. And Monsieur Barral, thank you so much for allowing us this time to crawl inside your head.
Okay, thank you very much to interview.
Monsieur Barral, what motivated you throughout your life to decide that you wanted to interact with people in such a deep way?
You know, there's something. I have a strange story myself. My grandmother was a bone setter. She a poor lady from Italy, and certainly she got some influence on me because she used to treat people with the hands. I was first a physiotherapist before to be an osteopath, and I love very much to massage people, to touch people, but it was not enough maybe to get good results, to have patients with better results. So it's why I try to go a little further in manual medicine. I'm very fond, I like the hands. I remember when I was even a kid, to see the hands of a person was very important for me. It's one of the things that I love to see when you see the hands. You cannot cheat with the hand. You have the hand, you know what is the person around.
When you started your background with physiotherapy, how did you connect from? Did you know that you were going to end up in something like osteopathy when you were studying physiotherapy, or was it something that you saw during your course there?
No, I was very naive. You know, something very curious. One time, a friend of mine, he told me, there is something, a kind of technique very curious. If somebody has a small scoliosis, you push in the middle of the scoliosis, there is a noise, and after you have no more scoliosis. I can tell you, I was very, very naive. And it's the first time I heard from osteopathy. So I know when I was a physiotherapist, I knew very quickly that I had something else to do. But I did not know osteopathy at this time. Osteopathy was totally not known in France, and nobody knew about osteopathy.
This next question I ask, it's kind of a personal question for me. As I had told you before we started rolling the camera today, there's so many people with different opinions within osteopathy. One thing that has been a very foundational concept for me has been the idea of a key lesion. Some people find it useful, some people don't. Is that a concept that has meaning for you, the idea of a key lesion?
Yes, of course, we try all to find the key lesion because we try to find the little stuff which can help a lot of patients. And very often it's difficult to find because what is a key lesion is a less secondary lesion, I suppose. Primary lesion, I suppose there's some meaning in primary lesion. So it's a concept I like very much myself because I love precision.
Mm-hmm. Some people would consider that a key lesion could, some people talk about in a physical realm, some people talk about in an emotional realm, and then some people would talk about in some other kind of realm. Does that have significance for you? Do you think someone's key lesion could be something that's not physical?
But when you try to divide, it's what they do in allopathy. When you try to divide somebody, of course, one is specialized in the right foot, the other one is the left foot. So it's why. So I prefer myself to know that you cannot escape to your brain, you cannot escape to your body, and both are together to make you a better life. So to do the difference is very difficult. It's why we are so interesting, because it's difficult, it's complex, very complex.
When a patient comes in to see you, how relevant is their chief complaint? The reason that they came to see you, whatever it is that they stated on a piece of paper or told you within a few minutes, how relevant is that to what your treatment could turn out to be?
Now, of course, it's important because the patient must express himself. I try myself to respect the patient. I hear what he's saying. But of course, I don't follow what he wants me to do. If you have a right shoulder problem, for instance, he come and he said, Doc, my shoulder is painful. You must touch my shoulder. You must do something on my shoulder. If you do this, you don't do osteopathy because you have so many reasons to have some shoulder problem. It's why I say, okay, you have a shoulder problem. Let's express your body. I check your body, and after I tell you what I find. And very often I ask them, how old are you? What is your name? And I prefer to feel myself your body, and after we speak. If you let a patient speak, they wait for a long time to get an appointment. They are so anxious to tell you so many things that if you are hearing what a patient is saying, after a certain time you are lost. You are totally lost. And very often they come with X-rays. You have 40 kilos of X-rays with a caddy. If you take the X-rays, so you spend your time. I'm an osteopath, I'm a manual therapist. I don't want to spend my time in looking X-rays. Radiologists are better than me.
Monsieur Barral, when you were a student, and let's include physiotherapy as well as osteopathy as far as manipulation, when you were a student, when you were learning, who inspired you?
It's difficult because it's, some people, of course, I was with John Wenham. John Wenham was excellent in structural manipulation with Thomas Demer, and both died. And I was not the best student, but I tried to understand. Demer was good in philosophy, Wenham in structure. But I told you before, no visceral manipulation, no cranial manipulation. It was rather simple. But we are good manipulator, but it was not enough. So on both sides, one meeting was important for me. It was with John Appinger, because I met him in 1977 in Paris. And I love to see the hand of this guy, because the hand were very generous. And when he put the hand on somebody, I felt that something was coming out of himself in the hand. And it was a meeting important for me.
How did, as you already stated, that visceral manipulation, when I went through school, and I'm generations after you, but when I went through school, we never heard of it. Our teachers may have touched on an idea or something, but not to the extent that you have expanded and developed this topic. How did you get led into that? How did that happen for you to start exploring those ideas?
It's what I said before. I'm a therapist. I know what is to fail, sometimes to be successful. And one time I treated a guy from a dorsal pain. And he went 2 weeks or 3 weeks after, very happy. He said, I feel very good now. So myself, I was proud. He said, no, it's not because of you. I met somebody, he did something on my stomach, and I felt much better after. And that kind of idea was like obsessional for me. And I used to do a lot of dissection in my life. Okay, I was with my dean. I was specialized in that kind of dissection of the organ. And I tried to understand why, in touching the stomach, the guy got less tension in the back. So it's why, because I failed, is because I met visceral manipulation. And the funny stuff. When I started visceral manipulation, my colleagues were against me. They said, what are you doing? It's not osteopathy. They said, what are you doing? Oh no, it's something that everybody does. And so it's funny in life. Sometimes you must push a little the frontier to make believe people. But they were against me. I have a good memory, a very good memory.
I know that you had told me, I had taken a course with you quite a while ago, and you had told me that before you had come out with, I guess more publicly with some of these ideas, as you were describing to us the way you felt these things, you explored this under thousands and thousands of fluoroscopies and these different motions to study the science of what you were feeling. Has that been your path through all these different aspects of visceral manipulation, or did you sort of require the scientific study initially, and then you said, no, this is what I'm feeling, I don't need to do that?
But, my dean was obsessional about dissection. But it was a chance for me, and during 4 years, each week I do a dissection of a person. And I was in a lung disease hospital, heart disease and lung disease. And people, they got a lot of TB, tuberculosis. And I saw that when you have a tension of the pleura, for instance, you have a tension of the spine, you have a deformation of all the bone, so an organ moving at certain times, okay, can create so many problems in the body that it reinforced me in the idea that visceral are very important. And after we did some experiments to take off some the lungs, the heart, and we checked that the solidity of a thorax is because you have organs inside, not only because of the ribs. So it's little thing. I was in theory a physiotherapist, but I did not do so much physiotherapy with my dean. I did more dissection, and it was a chance for me because when you have somebody with a fresh cadaver, you know where is the tension, you follow the tension, you see that the tissues are exactly where you have found with your hand. Because at this time, tuberculosis for people coming from Africa and so on, they died about tuberculosis. And before they died, they were in the hospital. So we checked these people. And we found in listening, we found in the different tension they got in the body. And we know, at this time, we knew that the hand is very good, fine, but the problem is to know what you find. You put your hand, you have a tension, but what is underneath? And dissection permits me a little bit to find.
Monsieur Barral, and this is a little bit question over the top beyond that. After all the study, after all the science, after all your considerable experience of seeing sick people, do you have thoughts as to why people get sick beyond the presentation? Some people have given me I've heard all variety of reasons why people get sick or why they have imbalance. Do you ever think that to yourself?
You know, I saw an interview of Woody Allen, and he said, people say I'm anxious, but I'm not anxious. Why to be anxious? You are born to be dead one time, okay? And you don't know what is life, and you don't know what you are doing in life. So why to be anxious? So for me, life is something difficult. Where somebody give you the life, and after you have many tension coming around us. We have physical tension, emotional tension, social tension, and so on. It's not so easy to live now. And I have a feeling myself that we are tension more complicated now. I'm a therapist since 40 years now, and it was more simple for me at the beginning. There was a kind of barrier between what is on the structure, between what is on emotion, on society, and so on. And this barrier becomes very difficult. We have a lot of pollution, we have a lot of war, we have a lot of riot, and so on and so on. So it's the tension you receive goes in your brain, goes in your body, and maybe it's one of the causes that we have so many people with bad condition now.
Do you think that you could say that it was easier and it was clearer when you began as a physiotherapist because you didn't have the experience that you now have?
You're right. When you are naive, it's very good, because when you have the feeling that the body is simple, but the brain is simple. With my friend Alain, we work a lot because we want to help the people to have a better hand and to help our patient. And each time we open the door, you have another door. Each time you open a window, you have another window. So, of course, it's a little more complicated. But I can say that my results are better than before, even if it's a little more complicated. At the beginning, I was not a good osteopath myself. And it's good not to be a good osteopath, because you know what you are missing, you know what you must do. And I'm a little suspicious about people in a few years saying I'm good results and so on. When you work in an office like me, 12 hours a day, you know what is the pain, you know what is to fail. What I said before, it's not easy. And when people say 90%, 95% of good results with low back pain, I say, give me your card. I will send you a lot of patients.
Yeah. We have a saying that is kind of common here in medicine in the States. We say that if your only tool is a hammer, everything you see is a nail. And so, and it's not an anti-medicine statement, but a lot of times if someone goes to a surgeon, they're going to recommend surgery, not because they're a bad doctor or something like that, but it's the only therapy that they have to recommend to you. And something else that you said reminded me of some conversations I've had with students that are waiting to learn, the one method or the one way that's going to fix all pain for them. And my experience has been that the more different ways I've learned to look at the body, sometimes it doesn't make it any clearer because there's so many different ways, as you said earlier, so many different ways that you might have a shoulder problem, not just one way that's causing it. But, I've had different teachers through my experience that told me there was just the one way, and then this person said there was just the one way. And then what I found is that people like yourself and other people with lots of experience found that there was a lot of ways. That's actually why I asked the question about key lesion, because for me it's been a way to steer past the patient directing me to go rub my shoulder because my shoulder hurts, because that piece of information leaves me lost. It tells me why they came in, but it doesn't tell me what's actually wrong with them.
You know what I noticed myself? When you are a therapist, you are more modest. People who are professional teachers, they don't need to be modest, because on the whiteboard, the blackboard, everything works. Okay?
Right.
When you are in confrontation with your patient, it's not so easy. And to respect, it took me a long time to respect the other, not to be jealous, not to, when somebody. What is for me important now is results. I have a patient, he has a pain. I would like him to have results, not for my ego is finished. I got an ego problem like everybody at the beginning, because it's not good to suffer in life. And life is so difficult, I prefer to have somebody smiling without pain.
Mr. Barral, can you tell me about a case that you had that maybe didn't go so well, but maybe changed you, or that you learned something from?
Yes, many cases, when you have people coming to see you with a bad disease, with cancer, for instance, and you try to help them, but you know deeply in yourself that there are no so much chance to survive. You do the maximum. For instance, the last person I saw with a pancreas cancer, she got a lot of problem. And I tried, and I said, what is this life? Why this person was suffering for cancer of the pancreas? She has no chance at all to survive. If you are sick and you survive, you are better after. You think about what you can do. You think about the other. But when you have no more chance to survive, myself, I don't understand myself. It's why everybody speak about religion and so on. Can you imagine somebody giving a cancer to a kid? What kind of religion you can believe? When you see a kid suffering and dying of a cancer, I have some difficulty myself to believe. A lot of difficulty to believe, because I saw it in the hospital. So it's that kind of remark. I'm on the edge now to think about a little more concept, philosophy and so on. But I have still this big problem with religion, because a good God for me must help the other, must not give some cancer, some bad disease. I'm thinking a lot now,
Can you tell me about a case that maybe went really well, that had a very nice result, but you really have no reason why it went well?
Of course, now you have many. Myself, I'm not focused on results, because when you are very happy because somebody goes well, it's a mistake, because it's your ego. When you are very depressed because somebody doesn't go well, it's the same thing. You put your ego. So I was like it at the beginning. No, I do the max I can do. I work a lot anatomy, because our concept is founded of anatomy. I don't feel so good when somebody feels good. I don't feel so sad when somebody. But I know when my results is not so good, I take a book of anatomy, I work, and after it's better, because we must deserve. It's not your question, but I don't think that people are gifted. I think that they work a lot. And if you don't work in your job, if you don't know where is the ligament, where is the fascia, where is the joint, and so on, you have the best hand of the world, it will not work.
Dr. Still, Dr. Sutherland, and others believe that God was the prime mover, and you've already given me some insight into, your thoughts about whether that may or may not be so. But let's just say between a patient and their illness and some other knowledge or force that you use to help them, where do you fit in? Where are you between their illness and the patient, and some sort of maybe healing force that they have within them? Or as Dr. Still said, the body's ability to heal itself. Where's your role in that?
My role, I need a second life myself, because in this life I'm not ready. Because it's so long to, what is life? If somebody can explain me why you are in life, and so on and so on. We all have a lot of ideas, but this idea, I was a little slow myself to build myself. I was very quite stupid at the beginning, but it was good because I told you I was not a good osteopath, and little by little I built myself. I'm on the way. I'm young enough to go on, but I'm sure that I will not find a second life. Maybe it can happen.
Monsieur Barral, if I were a student in your office watching you treat patients, and we were having a coffee break, what would you tell me if you were saying about the good old days of osteopathy? If you were saying what you miss maybe 20 years ago, 30 years ago, how things used to be for you?
But 20 years ago it was funny. 40 years ago, nobody knew what osteopathy was in France, for instance. It was something totally new. And we were in France maybe 10 or 15 to do osteopathy. Okay, we knew each other, and we got the feeling that it was like a secret army doing something very secret. And you have some people that were totally on neurosis, and they said, "Don't repeat what you do." The first book I wrote, my colleagues they came, they say, "You must not write a book because the other will know what you know, and that is not good." So it was funny. It was something. We went in England at this time. To go in England was something not so frequent in France, and it was good because it's the colleague. We are very close. We were very close from the colleagues with no jealousy. And now in France, you have so many osteopaths. An example: I was the first one in Grenoble. We are now 140 osteopaths in Grenoble. Okay, so nobody knows somebody. You are the young generation. They don't know what is to suffer to get something. I don't. It's no more my family now. As a friend, that is no more my family. It was my deep family at the beginning. Oh no, it's a profession.
Is there something that you would tell me that disappoints you about osteopathy today?
Oh no, because because the concept is so good. I love what Taylor still did, what Sutherland did. No, my deception is myself. Of course, it's not osteopathy because osteopathy is on the sky, myself on the floor. So my deception is myself because sometimes I had to be better, and I work to be better. But I know that there is a very big distance to join the real osteopathic concept. One time I was in a conference and the lady said, "Who are osteopaths in this audience?" And people say, "Me. Do you treat people with chronic bronchitis with osteopathy?" And everybody go down the head. We can do many things. We are a little too much specialized in some pain or some mechanical stuff or visceral stuff. I need something else myself. I know I need something else, a little more upper. But as I told you, in the second life, I will do it.
Monsieur Barral, do you think that passion is necessary to do what we do?
Action? To be active?
Passion.
You have body workers, and you have people with a soul. It's like in music, It's exactly the same thing. Yeah. So we'll never be Mozart, but it's an example for me. The idol of my life. I love Mozart. I love Sutherland because they have done something that nobody has found before Sutherland. That is something very nice. And that kind of people, they are genius. In our job, we cannot be genius because if you feel genius, you are dangerous for the patient, and you are dangerous for your colleague. But it's good to see people doing a little the maximum they can do. In osteopathy, it's an art, it's not a technique. And very often we have this difficulty to leave the technique to go to the art. And that is one of my difficulties.
Monsieur Barral, what are you discovering at this time in your life after 40 years of therapy? What's new for you?
what is new, many things, because it's you do a technique, and after you are okay. This technique is not so bad. People was better, and you say this technique there is something more subtle at this level, and you try always to be more subtle and to be more kind. The first osteopaths, they were very aggressive, with the fingers like it. Oh, no, we are soft. And we must give some peace to the patient. So when you see an osteopath like it, he is not an osteopath. You must caress something, you must you must move yourself in the atmosphere. So a good osteopath has a body flexible, the hand flexible, his life is a little flexible also. It's what I'm discovering myself. So I go on. I work a lot. I love anatomy. I can tell you with my friend Alain, we love anatomy, and we try to be the most precise we can, and we are not so bad. But
Monsieur Barral, what would you like a patient who's been treated by you, is there something that you would like them to know or to experience or to feel?
Yes, it's like a dog, like an animal. If you touch an animal and your hand is good, the animal looks at you and releases. The patient, he must feel that you feel. It's not what you say, because everybody can say, okay, good guy, I will heal you and so on. What I like, I say, give me your name, give me your profession, okay, and I tell you what I find. And little by little, the patient, he sees you on your body and says, this guy, he knows me very well. And after, there is no more barrier between you and him, and he lets you do what you want. If you are rigid, if you say, that is the truth, and you speak a lot, you write a lot, you are not more on the body. At the beginning of my career, I did some interrogation during half an hour, okay? And I treated 10 or 15 minutes. Now, I feel the patient in 1 or 2 minutes, and I treated 20, 25 minutes. It's different. And he let you do. And it's finished, yes, it's finished. He was in another world, and that is, for me, so wonderful. You must deserve that kind of connection with the patient.
I have one last question. If you had just one story to tell about yourself, excuse me, about a patient, about life, what would it be?
It's a different story. One is a real story, because I don't want to lie. One guy came to see me with his wife, and the wife got a neuralgia. Okay, I checked the wife, and I said, I found something on the lung, and I said, maybe it would be good, madam, to have an X-ray of the lung, because I felt a little tension. The radiologist called me, said, Jean-Pierre, there is a lung cancer. You must say to this lady there is a lung cancer, and it's not a good one. Okay? So she was with her husband. She died 1 year after. Okay, of course, I could not do something. The guy came it's a true story, 3 years after, with a new wife. She got a neuralgia. I checked the wife. I say, I feel a tension around the lung. I say, madam, it will be good for you to have X-rays. The person went to the radiologist. Radiologist called me, said, Jean-Pierre, we have a problem. There's a cancer, a bad one. She died 1 year after. This husband, he came 1 year after. No, he wrote me. He said, Jean-Pierre Barral, I trust you a lot, but I will never come back to see you again. And it's, sometimes I was not proud to find this stuff. It's what I said, because it was a life of somebody. When you see somebody, it's not the person, it's the life of the person. So I was not proud of it. My hand was excellent because I found, but after what to do? And it was a big suffering for myself, this story.
Mr. Barral, thank you. Thank you so much for this. This was a real pleasure.
From you also.
And I hope in that second life I find you.
We have time.